We are going to really, get into a few sessions as we used to do when it comes to our beautiful Ladies' Day. We started really with a brief introduction this very afternoon. That when we are talking about our skin issues, it does not only start with the external, but they have a lot to do with internal. And today I would like to really talk briefly on some things that maybe people might not be thinking about it. When we are dealing with skin issues, be men and women, one of the things we shouldn't forget to keep in mind is hormone activities in our body. So I'm going to really just open up some few things for us to see the most important thing whenever really we are dealing with our hormone issues. Somebody must say, is it important or is it necessary that really hormone should have impact on our skin? Yes. And I'm going to explain it a little bit more than even I thought I could. See, when our hormone now issue become out of balance, it causes a lot of things, on our body. From the top of our head to the sole of our feet. It do affect those very areas. Even women, sometimes it will cause them to suffer many symptoms, close to about 200 to 300 different illnesses in their body. But one of the main key elements that hormone can affect is when it comes to us deal with really what a stressful element in every human body. Anytime you are very stressful, you are stressful. Because when you look up to our daily activities today, from educational background, from a marital aspect, driving, environmental, almost everything we are dealing with today, economy, everything, stress play a lot of major part in our body. The only way you'll be able to really become stress-free is when you know how to balance your hormones. There are so many things we are experiencing today when we come to our skin condition. Majority of them really come from stress. There are some few things that I'm going to really caution us about. Number one, we need to understand the physiological aspect of stress. Every day, when we turn around, like the one time we came here, some few hours ago, we started dealing with some stressful issues over here. We were expecting a very quiet environment for us to be able to really videotaping this very session so that you can benefit. If we did not really allow ourselves to become a proper uniformly, we'll begin to really deal with stressfulness. Our adrenal level will begin to really have impact. Our blood sugar begin to really have impact. Our cortisol level begin to have very impact. These very things are all things that really, somebody must say, these very things are a little bit technically for us to observe them better because we are not having a seminar. I cannot go in a bit to give you definitions on things here and there wherever you have questions because we don't have too much of that very data time to be able to really expand on them. But if you want more information on those other things, there's going to be a special seminar that you have to pay and come and say them for really the whole day. And we'll really begin to deal with many of the things I'm really trying to highlight over here. Not with that very stressful element alone. There are things that really we have to really understand clearly. Number one, we should know that really stress do affect even our heart issue, cardiovascular system. Not with that alone. When you are very stressful, it will affect your what you call your thyroid function. Not with that alone. When really we are very stressful, there is one thing that is known as adrenal stimulation system. We have them. If your adrenal system are not working very well, you are in trouble. And all have something to do with really very stressful elements. Now, when we are looking up to some few of the things that really I think do affect our skin, the moment really your hormone level begin to really decline, it does not only affect you as a human being alone, but really it do extract a lot of really the water stuff out of your body. So let me just say by getting to some few points over here, we have to understand what is known as hormone changes in the body with your skin. The moment your hormone begin to change, your skin texture also begin to change. Your hair begin to really to change. The elasticity of your skin begin to change. Your youthfulness really begin to change. You will see so many things that goes on whenever we are dealing with really hormone. Now, whenever really you begin to really talk about hormone, there are so many fearful elements that people really do think about. I don't want to scare you. There are so many what is known as synthetic hormonal compound, such as progestin and their parties. Many of these progestins, they are good for some particular period of time. When you are being placed on progestin protocol, within 4 years time, and you are not really overloading your body with many of these very kind of synthetic properties, it won't affect you. But if you are on it more than 4 years up to 10 years, you are going to really consider yourself that really you are finding your way to really begin to fight cancer. So we thank God that really we have amazing scientific body, including my entity called American Academy of Anti-Aging Medicine. We have really our body that really we are recommending, a hormone approach that whenever you begin to apply them, it will set you free from many of these very fears we are talking about. Fears that really will hit you whenever really you are using progestin and their families. One of the elements we could recommend is what is known as progesterone. Progesterone happens to be a natural hormone that really God has given to you and me, and it is in the body. When you are between really 1 year to 13 years, young lady, you are really this progesterone level, they are almost 100%. We have what is called DHEA, which also really do help with really hormone element. We have melatonin, and so forth. We have progesterone, that is progesterone, progesterone. We have them also really in our package. When you are on any of these properties, it helps your body. You do know that there are so many people in our world today that really they find it difficult to sleep. When you are stressed, you can never sleep. And when you couldn't sleep, it do affect your your skin. It do affect you inwardly. So let me just go through some few things that I've jotted down that I think really will help us. Number one, if you want to really overcome your hormone issues, number one, make sure that really your progesterone level they are optimal. Number two, your testosterone level have to be really also really on that very same level. The third thing, your DHEA should be really playing a major part in your body. Number four, your melatonin level have to be really precise, accurate. All these elements or compounds that we are talking about, they are all natural things that really it is in the body. But whenever really your hormone become out of balance, all these very things declines. And when it declines, it affects you. Not only your health alone, but it affects really what? The way you look on the outside. Wrinkle happen to be one of them. Dark spots happen to be one of them. Puffy eyes happen to be one of them. Your hair condition happen to be one of them. Your nails, whenever they begin to break, that is you are having deficiency of many of these elements, such as vitamin really E and possible really A in the body. So it is very, very, very important. Some people might say that, well, you know, whenever I go into the Janike or food store and go and buy healthy food and I'm eating that, go together. Can I tell you something? It takes a lot of amount of those that are really hot vegetables that you're going to eat. It takes a lot for you to really get the optimal ratio that you need. That is why we thank God that scientific body will be able to really have a lot of studies done and prepare many of these supplements so that we will be able to really take them to substitute all that we are burning, we are losing. Now, a question comes this way. Who are those who are at risk whenever really we are dealing with these very hormone serious ones? Those really are within the risk parties. Women that they are between the age of really 45 to 70 years, they are those who really they have to be very careful about these very things. Some of the things that they will be experiencing more: hot flashes, mood swings, depression, osteoporosis, and all these bone conditions here and there, here and there, here and there, here and there. Those are the things that really people have to be very careful. Why these are the things? Because during the time they were at the age of really from 1 all over to 13 years, they have not taken time, or nobody had educated them how they can arrest these very symptoms when they are very young. So this became a part of them, and it's eating them up while they happen to be very young, on and on and on. Some of them, if they are misfortune, 30 years going, they begin to experience many of these very things. Anytime you are begin to experience a hot flashes in your body, that really your hormones are out of really balance. You'll be happy, you'll be so hot like they are putting fire on your skin. Within 3 seconds, within 30 seconds, within 40 seconds, within 1 hour. When they put that body in your skin for 1 hour, it will kill you. But thank be to God that whenever people are having hot flashes, it can quick, and within a twinkling of it vanishes. On and off, like you have to tear all your clothes around you. We have properties today that they are safe, that whenever really you know how to really use them properly, it's going to affect the body, impact the body. Many of our skin products that we are carrying, we have really done a lot of study on every ingredient that we have, about almost close to really 27 of them. Every one of them, they have the same amount that really work. Many of these that really work, progesterone really has. So whenever really begin to use the product on your skin, it absorbs into your skin. It absorbs into your skin, and it begins to repair, restore many of the damages that really could have taken place, or they are taking place within your body. Now, I'm going to really allow some few things. See, one of the things that really, from our studies, we have discovered, anytime your hormone become out of balance, it does make your skin very thin. That is why many often when people are aging, you can start with the skin begin to wrinkle. When the skin becomes very thin, then that's the result, like you have a real hole.
And sometimes how you can see, like, you can start to see your veins come through.
Exactly, because really you can see really that really hot. The skin that will have to cover those veins out, they begin to really shrink.
It gets thin, and you can see.
Thin, so you can see them really out there. So we need to really begin to take care of from the inside first. Then whenever we take care of the inside, then whenever we are taking care of the outside, we're going to have amazing results. There are so many people that they will say, well, oh, this very product really is on the market. They say it's good for face, it's good for the skin, it's good for that. I'll tell you something. It's just a temporary deal. That is why we want to educate the people to know what they are dealing with. So whenever they begin to really purchase our products on the market, we will show them how they can take care from the inside, so that with the result on the outside, it becomes really what you need. You don't mix nothing. That is why we want to really encourage people that they are going to keep on buying this product. We would like to work hand in hand for them to begin to approach our American Academy of Anti-Aging Physicians. They will be the people that will be really work using many of the products that really we are promoting to help to treat their patients with their skin need. Because we need to educate the people to become aware of this very thing. And believe me, a physician will not have time to give you 15 minutes of his time to begin to educate you. One thing that you have to understand. So you have to take advantage about many of these very things we are sharing. I respect Dr. Oz very well because he tried to really give people wisdom whenever it comes to really what the health issue, elements. We try to help the public, make them awareness, show them different things, but you have to begin to help yourself. But how can you help yourself if you don't know really what really the material that you need? That's why we are making these very free sessions available for you. So that will open up your mind, open your really world. Can I tell you something? Today, we have begun to share and have many testimonies that really they are saying that men are living up to the age of really 120 years old again. Women, the same. Oh yeah, we have a data, we have a really we've really with our Life Extension magazine. In America here, one from England, and one from I think Germany or Canada, one of them. We have the really, I was really moved when I saw it. What made these people to live very long? They know how to take care of themselves. They are raised the same thing before they begin to really out of it. You see, God did not really create human beings so beautiful. Then when they get to certain particular age, they begin to really get into certain really well, ache here tomorrow, ache there tomorrow, and so on and so forth. When you begin to have all this very discomfort in your body, God is saying, you know what, wake up, and begin to really do something. If you need to rest, rest. If you need to really take a proper really supplements that really will meet those very needs, do it. I have one guy that really worked with me. I'm talking about probably I might be a little bit older than him. Anytime really, he get on the job, he said he's getting old. I said, don't tell me that you are old. You are thinking that you are old. And because you are thinking old, the Bible says, as man thinketh, so is he. Doesn't mean pain will come, But when the pain comes, try to really find out what you could do to be able to really suppress the pain. There are so many wisdom, so many elements to it that are available. You have been having a pain situation with your body and nothing was working. Can I tell you something? You make an appointment and contact me. I'm going to show you something, not Tylenol, not ibuprofen, and none of those direct aspirin, so and so forth. We have elements that we have really done a study on it. That whenever really you are going through the pain, because the pain that really you are going through is a free radical that we are dealing with. Something is eating your really core, your bone. Something is eating your marrow. You have to really get something there. You see, there is a cushioning between the bone densities out there. So whenever really for the jelly aspect, I'm trying to use a common language that somebody will understand. There is a jelliness in the raw cartridge, if you will, in those very bone elements out there. So when those very cartridge begin to burn out, the bone begin to rub itself. So the friction and the reaction that you might be having in the bone that rubbing itself is the result of the pain you will be having. I have steps, about 4 of them. I run on the steps like a really 23 years person. If you said I'm only joking, I'll take somebody over there to my steps over there and video it, and let's see what I'm talking about. I run like a really like a mouse. Joy is like laughter is like a medicine to the bone. So it is very important. Okay, it is very important that we have to really understand of these very things. You ladies, you have to really begin to become aware of your real your consumption of calcium. Calcium is very, very good. But whenever you keep on taking or drinking the calcium by itself, the tablets alone, it will get to a point whereby really that really will affect you. Okay? If you take whereby it will affect you. You need to begin to really, really take care of those very areas very, very well. At least you should be able to be taking calcium. If you have not been taking it for a long time, about 800 milligrams of calcium you have to be taking them. And sometimes whenever you take the calcium alone, there's going to be a problem over there. You have to really know how really many ratio and the dosage you have to take on the calcium. Because when you take too much excess of the calcium into your body, you have kidney stone. So you have to really know how to really balance these other things. Your vitamin D, with the people in Pennsylvania area here, our vitamin D intake is very, very, very low. We don't have even any, you see. And whenever you go into many of our beautiful GNC and Rad 8 and so on and so forth, many of the properties that they have over there, they put just small dosage of vitamin D in them, up to 400 milligrams, whereby your body really needs close to about maybe 2,000 milligrams of vitamin D in your body. Our life extension, we have really, a scientific body really have done a lot of study on this very element that we carry up to 5,000, vitamin D3 international unit. That
in one pill.
One pills. You see, one pills. You see, there was a patient that really, she went to, a West Bend hospital, and at that time we have these very properties, and we were talking about it. And in fact, they give her, a script that really she should really get vitamin D. So we sat down, we talked about many of the elements. And I said, before you take our vitamin D, 5,000 milligrams, go and show it to your health professional at, I think, West Bend Hospital here. Go and show it to your physician first. And tell me what your physician said. When she went there and she showed our compound to her doctor, the doctor said to her, do you know what? Don't take even the one that we recommended. Be taking the 5,000 milligrams IU, international unit. And can I tell you something? That very product has really helped that very person, miraculously. So what we are talking about, there are so many data, so many testimonies about the things we are talking about. Your body needs it, my body needs it. Can I tell you something? Right now I can be playing soccer again. I used to play soccer when I was at the age of maybe even 33 years. I was playing soccer in this very country. But it get to a point where I couldn't run like the way I used to. When I'm running, my heart were breaking apart. My legs were breaking apart. I was in pain constantly. But when we begin to arrest all those free radicals, can I tell you something? I can jump, I can run. I run on the stop like a mouse. And I don't feel any pain anymore. You see, I don't feel the pain no more because number one, we found out the underlying cause of the situation. So these are some of the things. Now, I'm going to really open a little bit for us. If somebody wants to ask any question relating to some of these very elements, especially also our melatonin. There are so many people that they have a deficiency of melatonin. So due to that, they do find it difficult to sleep. Stress really consumes them a lot. When you are living as a human being, you work for really 8 hours, 9 hours, and you did not rest. Can I tell you something? You are pouring a lot of poison into really what you are being. So I'm going to really pause a little bit here. And if somebody really have a question, we'll really just open a session for question and somebody asking the question, then we take it from there. I hope this very brief time here has given you a brief wisdom and understanding. We are not here to really begin to tell you that go and buy these very properties without any physician really wisdom. So whenever you want to take any of these very informations, please contact us. We can really help you a little bit more than you just go to really what Route 8, GNC and so on. So go and buy this very thing to swallow them. Because sometimes people take these very properties without a blood test. And if the blood test is not done on your body, you are swallowing them, you can overdose yourself and it will cause a lot of damage to your body. We don't want that to happen. What we are dealing with you right now is about education. We are not really trying to diagnose anything here. We are not going to prescribe anything here. We are just giving you a wisdom for your understanding. Thank you that you're going to work with us as we are growing together to live in the wonderful, beautiful, beautiful world. Thank you so much.